Our first speaker is Sophie. Sophie's a 22-year-old neuroscience student at ANU who volunteers for Lifeline, Headspace and the Refugee Action Committee. Sophie's dedicated to the field of mental illness and is extremely passionate about improving mental health services and the population's mental well-being. Please welcome Sophie.
Hey everyone. So keeping in mind that youth is most often described as people who are 12 to 25 years old, can everyone here please raise your hand if you were once a youth or are still a youth? Yeah, that's a pretty good indication of what I thought. So this alone is a big reason as to why we should listen to youth. Every adult was once a youth. Every one of you who aims to make a big impact in this world was once a young person with plenty of ideas, plenty of feeling, and at least a vague sense of direction and future planning. It is cliched, but it is true. Youth are the next leaders. Youth are our next hope. Youth are the world's future and our most enthusiastic change agents. So it is clearly important to listen to youth. But why is youth mental health such an important field for us to focus on? Well, let's start with some facts and data. Did you know that in any 1 year, 1/4 of the youth in the ACT have a diagnosable mental illness? There are approximately 80,000 youth in the ACT every year, so that's 20,000 youth each year who have a diagnosable mental illness. Mental health, as I'm sure you know, also directly relates to so many other significant issues in our community. Some of these include homelessness, stigma, self-esteem, the economy, population health, employment, substance abuse, education level, quality of life, and individual contribution to society. Improve mental health intervention, and we will be well on the way to improving all of these other issues too. So how do we improve mental health intervention in the ACT? I believe that we need to improve how our police treat youth, our adult mental health unit at the Canberra Hospital, our access to subsidised mental health care, shorter waiting lists for psychiatrists and psychologists in the public health system, our community and early intervention services, and our crisis teams. There are so many facts I could share with you about mental illness in Canberra. However, I don't have much time, so instead I'm going to tell you a true story. Ben used to be my closest friend. Ben had an extremely traumatic childhood, and by age 19 he had experienced no early intervention, and so you guessed it, he had several mental health issues. Between 2011 and 2013, Ben had 5 suicide attempts. During one of his first attempts, he jumped in front of a car on a major Canberra road. I was there, and as much as I tried, I could not physically stop him. The police arrived just in time and subsequently threatened Ben. The officer specifically threatened to shoot Ben with his gun if he did not calm down. This absolutely took my breath away. That is just one of the many examples I've seen where police officers have treated a young person with mental illness horribly in an emergency situation. At another one of Ben's suicide attempts, one police officer on the scene told me that suicide and mental health is the 3rd most common reason that police are called out in the ACT. 3rd most common. And yet, I've also been told that rookie police have next to no mental health education during their training. How does this make any sense? On another occasion, Ben was self-harming in his own home. I called our crisis team, the CAT team, and the CAT team arrived, but as the front door was locked and I was in the back of the house trying to keep Ben safe, they left and didn't try to intervene. Instead of trying to knock the door in or call us or come around the back, they just left one of their business cards in the door which said, "We tried to contact Ben." I felt completely abandoned by ACT services. On several occasions, Ben was admitted into the adult mental health unit at the Canberra Hospital. The building looks so pretty on the inside and out, but anyone who has visited a loved one in there would know that it isn't as beautiful as it seems. The patients are ignored consistently by staff, the patients' dietary requirements aren't taken seriously, and patients aren't allowed to use half the facilities. Ben was not given repeated or consistent psychological or psychiatric care in the facility. Each time the hospital released Ben into my care because Ben's family was not around. I was 20 years old and I was not qualified to be a mental health carer. I told the hospital that this was not appropriate, and yet they still did it. At one point, Ben said to a mental health nurse at the facility, "I feel safe in here. I do not trust myself with my life. Please let me stay here until I get treatment." And yet, he was still forcefully released, because according to the nurse, they had already promised his bed to another patient. From then on, the only people who offered Ben psychological intervention either charged a lot of money or had a 9-month plus waiting list, so he went without professional care. Ben's story continued until one day in 2014 when he cut off all contact with his family, his friends, and myself. I have not seen him since and have no idea if he is okay or not. No ACT services have offered to help find him or provide him with mental health support. I'll stop the story there, but please let me remind you of 3 major points before I leave you today. 1. The ACT desperately needs more multidisciplinary psychological intervention services which are affordable to youth and readily available for people in the mild to severe mental illness range. 2. We need to better educate those who work with youth in emergency situations, including local police and staff at the Canberra Hospital's Adult Mental Health Unit. 3. Existing services, including the CAT team and Headspace ACT, are in dire need of more funding and staff so they can try to support the ever-increasing number of mentally ill youth in the ACT. I didn't get to discuss all my ideas today, so feel free to contact me if you have any questions or if you want to have a chat about mental health in the ACT. Together we can make changes in the ACT mental health system, so let's get started. Thanks so much.